for those of you who've probably not been to Compassion Action Network and who we are and what we do, our mission is to foster collaboration. We're not a nonprofit. We share resources to solve issues and address things going on in our community. I am a board member. We have other board members in the room. Please stand if you're in the room. I know some of our people are downstairs too, but Gail Alexander from Anoka County. There are about 7 of us, and we work closely together and try to come up with these great presentations. Before I forget to tell you, in May, we're going to be doing a presentation on food insecurity. And that's a big issue that we're dealing with in Anoka County, probably all over the country. The exact date and the location to be determined, but if you were able to sign in on the mailing list, you'll get a notification about that as well. We want to thank our hosts for this beautiful venue, which is really the nicest place I think we've been to. We've rotated these events around, and they've done such a beautiful job. So Wally Wysopal, first time I pronounced that right probably, the city manager, Scott Lund, our mayor of Fridley, everyone's favorite mayor. And then we also had Deb, I don't know if Deb Dahl is in the room, but she has really helped us and just done a fabulous job of helping us coordinate everything. And then Steve Eggert, who is on the Fridley City Council, and you have an organization called Positively Fridley, which is sort of a networking group and identifying resources similar to Compassion Action Network. So thanks again for letting us use your facility here. But the main reason we're here today is to listen to a great speaker, Jaime McKenzie, who is the Senior Program Manager for Social Responsibility for UnitedHealthcare. And when we were looking for topics for this event, we wanted to do something on volunteerism. So we Googled volunteerism, and the first thing that came up was UnitedHealthcare and all the research that they've done on the health benefits of volunteering. So Jaime is a senior program manager for social responsibility. She's spent the last 10 years advancing the mission of building healthier communities and executing philanthropic initiatives, which engage 60,000 employees nationwide. She's responsible for managing the Do Good, Live Well employee volunteer program, which has grown 800% since its inception in 2010 with 334 volunteer projects in 96 cities and 31 states, and two of which included breaking a Guinness World Record, which you'll have to tell us about. Jaime knows real change happens when people work together, which is why she's built strong partnerships with hundreds of organizations of all sizes, and she's going to talk about that. She's driven by the desire to help others and has supported dozens of nonprofits in the Twin Cities with skills-based volunteering and council support. So with that, I'm going to turn it over to Jaime. And there will be an opportunity for questions. We do have a couple panelists that are going to talk about their work in Anoka County, and then we will have an opportunity to go back down to the resource tables. So turn it over to you, Jaime.
Thank you for that warm welcome. It's such a pleasure to be here with you folks. I love your city. I grew up in Apple Valley, Minnesota. I currently live in Lakeville, and so it was fun to make the trek up to the beautiful north today. And like Pat said, I've been at UnitedHealthcare now for about 12 years, but really focusing on our employee volunteer program these past 10 years. We're super excited that Do Good, Live Well has our anniversary this year. We're doing a bunch of celebrations on that program. And the beauty of it is that it's both an internal volunteer employee program, but it's also a program to inspire service with the whole country and to get people out and to get people to realize that doing good helps you live well. So that is actually why we named our volunteer program Do Good, Live Well, because we ended up doing a study in 2010 with Volunteer Match, which is the world's leading nonprofit expert on volunteerism. And so we said, you know, we're a healthcare company, there's volunteering, there's got to be a tie, right, to health. And so that's how Do Good, Live Well started, is because the study did show that there is a tie. And volunteering does make you feel healthier and happier and improves your well-being. And so that is kind of the fun story of how we started. Volunteering is a big part of my life. It's a big part of my job. And I like to say it's just, you know, my job is warm and fuzzy, but it's it's, you know, it's a serious thing that really makes a huge impact to everyday life for so many people. And I want to tell you a little story about Jackie. This is Jackie, and she lives in Scotland. She is a volunteer with a nonprofit called Canine Partners. For 20 years, Jackie suffered severe depression. She had to quit her job. She got addicted to painkillers. Her husband left her. She went into just a deep, dark place and ended up trying to actually take her life 2 times. She was just at the bottom of the barrel in despair when her mother handed her the newspaper and said, hey, you should look at this. You know, they're looking for volunteers to train dogs to help people with physical disabilities lead more, you know, productive lives. And it was at first a really scary thought, but she said okay, and her parents drove her to the nonprofit, and now Jackie is thriving. She is happy again. It's given her purpose, and she literally says that Canine Partners has saved her life. And she is now connected with her community and other people that love dogs. And it's just a unique story to me because, you know, so often we say, oh, I volunteer and I want to help my community, but it really does change people and changes lives and communities. So back to Do Good, Live Well. Just a quick overview of it because it's kind of fun, and if you can talk about Ashton Kutcher, I feel like that's entertaining. But back in 2009, President Obama made a call to service to all Americans. And so the Entertainment Industry Foundation actually got on board and created a campaign called I Participate, which brought companies like UnitedHealthcare and AARP and other big ones together to really say, we want to get behind this and we want to try to inspire service and volunteerism in America. So we signed on, and all these celebrities got on board, and it was pretty fun. We got to meet some of them, and we did all these big volunteer projects. And so really then part of that was major broadcast networks got involved, and all of a sudden the sitcoms had themes around volunteerism, and we were doing PSAs with Gwyneth Paltrow. So this was one of the ads that we had. Her and her mom actually did a video just talking about how volunteerism is a big part of their lives and why they do it and why they're passionate about it. And so it just really was this huge push. So it was the perfect timing for us to say, well, hey, yeah, we're just coming out with this study. So we jumped on board. And that's really how we kind of launched into the public eye, was through this I Participate campaign, which unfortunately doesn't appear to be running anymore, but we're happy that we kind of came out of that and we're still going strong. AARP is actually still going strong from theirs is called Create the Good. It's a similar program where they just are promoting volunteerism to AARP members and what have you. But that was how we got our start. Next, I'd like to show you a little video about what volunteerism means to our employees at UnitedHealthcare and how we give back.
At UnitedHealthcare, you don't have to look far to find someone.
Hold on a second while we get this right screen up here. It defaulted back. Okay, that should be good. All right.
Believe. At UnitedHealthcare, you don't have to look far to find someone who believes in the importance of giving back. Last year, our employees spent more than 280,000 hours volunteering to support more than 4,000 nonprofits and communities where we live and work. Building healthier communities is our social responsibility mission, and through our Do Good, Live Well volunteer initiative, you did just that by improving fitness facilities at high schools, building new play spaces for kids, providing fresh produce to our hungry neighbors, and so much more.
We're not just an insurance company, we're part of our communities, and we highly encourage our employees to volunteer. But what we want to do is really help people to do better in their communities, live a better life, live a healthier lifestyle.
Our Doing Good is Good For You study shows that volunteering makes people feel healthier and happier, they receive mental and emotional benefits, and volunteering even improves your mood.
I would recommend participating in an event like this because it brings you a sense of pride, fulfillment, a sense of being helpful to others.
We're going to blast doing this today. I mean, it's been a lot of fun. It's been a good chance to get hands-on, collaborative, we met some new people. And so I think just being involved, even a few hours a week, can make a huge difference in somebody's life.
If I was speaking to someone that never got out here, you're missing out. You've got to come, be a part of this energy, and just the good feeling that you get once you've had a chance to give back.
Thank you for demonstrating compassion in action and bringing our mission to life.
All right. That was the video that we showed our employees, our 60,000 employees across the United States, who every day engage with us in some way or another on volunteerism. So it's fun to be a part of a company.
There's no such thing as a perfect
I'm sorry about
honor.
that.
This is why I use breath.
That really does give back. All right, I think we're back here. Trying to go, how do I go full screen here? Display settings. Thank you.
Oh, absolutely. This one's confusing for me too. I wonder if you can just end the slideshow and then redo it from there. And then I just
Okay. All right. So our Do Good Live Well program, we do generally about 50 to 55 volunteer projects every year. Last year we were in 28 cities and 19 states, benefiting 64 partners. We really try to focus as much as we can on our areas around hunger and obesity. So we do everything from playground builds. We've done actually over 30 with Kaboom. They're a nonprofit that does playground builds all over the country. The Vikings does every year with Toro across the metro area. Just as an example, we do one every year with the Patriots. I know. We're in Minnesota, so we could say boo. No. But yes, we do a lot of good work with partners like that just to try to also help get people's eyes on volunteerism and what we can do is just, again, trying to give back to the community. So about 1,600 of our employees volunteered with us last year, which was about 7,000 hours. Through the playgrounds that we built, about 38,000 kids will have a safe place to play over the life of those playgrounds. And then another cool thing that we do is work with a lot of high schools and boys and girls clubs to take old weight rooms and old gyms. Lots of schools that we visit across the country, they're not doing recess, they're not doing Phi Ed classes because their equipment is old and bad. So we also go into a lot of those facilities and say, hey, we want to buy you new equipment. We want to come in for a 2-day volunteer project and just get it all set up and paint and just give students more access to living a healthier life through fitness and nutrition. So that's how we've been able to activate more than 20,000 square feet of fitness space, impacting more than 8,000 kids across the country this last year. And then around our Hunger Initiative, we've been able to provide over 3,300,000 meals last year. We work very closely with Second Harvest Heartland, if you guys are aware of that great nonprofit. We partnered with them since 2011, and we're the sole funder of their mobile pantry program, which is a great program that is taking fresh produce from July through October and getting that into the community. You know, it's one thing that, yes, we need to feed people, but it's even better if we can feed them fresh and nutritious foods, So they have great relationships with farmers who, you know, will give them some food, and then we get the volunteers and the funding to actually get the food off the truck and then get it into people's hands that need it. So that's been a really, really strong partnership for us. So if you haven't worked with Second Harvest, they're a great one. And then on to the study. So part of the reason how you guys found us. So again, we really wanted to know who, you know, we just instinctively knew that volunteering must be good for your health. So, but we wanted to also know who's volunteering, you know, why, where, how often, what are the benefits, aside from just physical and mental health, and then how does that impact health? Interestingly enough, anybody have a guess of percentage, like how many Americans said they volunteered in the last year, according to the study? If you said a quarter or half, anyone guess? 70%. It's actually 1/3 of Americans said they volunteered in the last year. That stayed pretty steady. We've done 3 of this same study now around volunteering and health. We did the first one in 2010. Our company did one in 2009, and then this most recent one. And that number has stayed the same. What's really gone down, though, is the amount of time people are spending to volunteer. And when we ask them why, they actually say it's because of time. And it's a funny thing, right, about our day and age. You know, we have all this technology and things that we say make, you know, give us more time, but really time is just this asset that we're always just grabbing at, and people just feel that if something has to give, then volunteering is kind of one of the first things to fall off the list, apparently. So, and a lot of it, I think, is just that idea of being overwhelmed and feeling like you don't have enough time to volunteer. Generally, we see that people who are coming into volunteerism and putting up the bigger numbers, at least this last study, was younger millennials getting more involved. Our lapsed volunteers are ones that are getting a little bit older, unemployed, which makes sense. And so overall, the numbers have been pretty steady, and also the benefits, which I'm going to get into next. First, just some quick kind of methodology. We surveyed about 2,700 adults over the age of 18 for this study. It was done online, and data was obviously weighted to ensure a good sample. So the biggest results can be really summarized into 4 buckets. One is health. Volunteers say that they do feel better physically, mentally, emotionally. They say that they feel less stress. They feel that they have more purpose in life, which is huge, right? Especially for our retirees, having that purpose actually makes you live longer. And then engagement. So volunteers are just more engaged in their health and engaged in taking care of themselves. And volunteering just makes people feel like you're part of a community. Even if you're doing it by yourself, you still feel like you're part of this bigger community of people that want to give back. So as you saw in our video, these are the main physical and mental health benefits. I just think they're amazing numbers, that 93% say that they had an improved mood after volunteering. I don't know about you guys, but I volunteer a couple times a month, and I can definitely attest to that. My days that I volunteer and bring food to homebound seniors I always have the best day after that. And my mood definitely does go up. 75% say that they do feel physically healthier by volunteering. 79% say that they have lower stress levels. And this one's interesting to think about self-esteem, that 88% of people that volunteer say that they feel better about themselves by giving back. And the intrinsic benefits of volunteering, these numbers also are really great and really high. So 94% of people reporting an enriched sense of purpose. My dad recently has been having a hard time. He's 73, and he just said, I don't feel like I have a lot of purpose. I'm sitting at the house, I'm going, and I said, Dad, why don't you volunteer? Like, just get out there and just, you'll feel better. And sure enough, he did, and he has met a couple friends now. And so just, it's something that people don't think about that really can give your life a purpose. 89% report an expanded worldview, probably because you're meeting people, you're seeing, how other people live, other people's struggles that you might not have really thought about or considered. And 85% develop strong friendships through volunteering. I've gotten to travel the country through my job, and I can definitely attest to this. I have probably 40 friends that I've met on Facebook now that I've met at volunteer projects, and we keep in touch and just talk about what we're doing and some of the struggles that we have, just whether it be, if some of these are also volunteer coordinators. So when I say struggles, just like, oh, are you getting, how does your volunteer numbers look? But I really have developed a lot of good friendships through volunteering and through my job. So again, one of the biggest concerns with the research is that the time spent has gone way down in our studies. And again, it's just not sure exactly, what to do or how to, what the solution is, but we just keep kind of trying to tell people to, if you are going to volunteer, go for something that's meaningful to you. Look at your passions, look at your hobbies, and really find something that's a good match. And look at what skills and experience you have. A lot of people don't realize, like, oh, I'm actually pretty good at web design. I could help a nonprofit that's looking for that. There's great websites such as sparked.com. Actually, they just changed the URL, so it's now called Power by Change, I think, .org. But these skill-based sites are a great resource. Volunteer Match, the nonprofit that we worked with on our study, has a wonderful site where you can search thousands of volunteer opportunities based on your location and your skills. It's just volunteermatch.org. We actually provide funding to Volunteer Match so that when people go to our website, which is dogoodlivewell.org, they can then basically use the Volunteer Match system to search for different opportunities, create an account, track hours, all that good stuff. So there's an endless need, especially in this day and age with policy and funding. Nonprofits more than ever need volunteers to just really improve our cities and communities. And again, like we try to tell people, don't get overwhelmed by time commitments. You can do as little or as much as you want. Just every little bit helps. And then this kind of is shifting gears a little bit, but wanted to just put this out there for some of you who might be interested in how an employee volunteer program is the most effective. This is something that we adapted from thepointoflight.org. If you guys have heard of Hands On, they're a big organization here in the Twin Cities that will help nonprofits and also corporations like UnitedHealthcare kind of navigate this volunteer realm. And this is their 7 practices that we definitely have followed. So I realize that you can't read this right now.
We'll have the PowerPoint
Yes,
available on our
yes,
website.
yes. But I won't bore you with all of it, but just know that, yeah, having a plan, having a focused effort is the first practice. Then designing that around your corporation's assets and your policies and structure to really just scale and deepen engagement with your organization. You got to have the right leadership behind it. They really have to believe in it I think at UnitedHealthcare, that's something that we just every day, we always call it, we're fighting the good fight, to just remind our leaders and remind everyone that giving back, both, financially and through volunteers, is just so important. So you got to have some leadership that really promotes and believes in it. Partnerships, having strategic partnerships is just a must, whether it's working with right nonprofits, government, private corporations, and then having the people that are going to obviously be a part of it, such as your employees and your staff, really enriching, their experiences, workplace skills, just increased morale. It's all a part of it. And then measurement is super important. Just making sure you're keeping track of what you're doing and how you're benefiting your community or whoever it is that you're obviously benefiting. And then really recognizing your success and your growth, celebrating, learning from your peers, volunteers and partners, and just always trying to grow and get better. All right. So I would love to hear any questions you guys have about either volunteering or what we do at UnitedHealthcare or the study. We're constantly just out on social media as well, Facebook and Twitter and Instagram, trying to put not only telling the public what we're doing at UnitedHealthcare, but also what other people around the world are doing. I think sometimes in this day and age, it's easy to just get bogged down that it's just with all the negative news. We actually do something what's called Do Good Week in November, where we go out on social media and tell everybody, hey, just for 1 week, let's all just celebrate the good in life and not tweet something bad or tweet that, the roads were awful or you don't like so-and-so. And it's taken off. So if you follow us on Do Good, Live Well on those channels, I'd love for you to engage with us on that. But really just trying to be kind of that shining light to just on volunteerism. And so I'm looking forward to partnering with you guys, and love to hear your stories too about how you're giving back. Yes.
My first comment is I'm really surprised that only a third of the population is volunteering. I'm just kind of wondering if that might change over time, all of us baby boomers retiring, et cetera. Because I hear from seniors and people that have retired, they're just so busy volunteering with their passions. And so I guess that's kind of a surprise. I'm wondering if you think that might change.
That's a good question. So she's surprised that only a third of Americans are volunteering. And will that go up? I think it will. I think you're right. With baby boomers going into retirement, I do know quite a bit who do. And millennials definitely, and the younger generations, they look at volunteerism as just, well, we know that they think highly of it because they don't want to work anywhere that doesn't have that really ingrained in the culture. So we have a lot of them, obviously volunteering. But the problem is, I know part of the problem is that for us anyway, it's just the tracking or even just remembering that you did it. So at UnitedHealthcare, our employees, if they volunteer at least 30 hours a year, they can give $500 to a nonprofit of their choice. And you can't, believe how many times people are like, oh, I forgot to track my hours. And, it's something so simple. But yes, I do think that as a whole, I'm hoping it goes up. But I think for sure that population is something that we're going to look at a little bit differently. So we could say, hopefully maybe more of people 50 and above are volunteering and really kind of look at it more by age. I think I saw you first.
I've been reading a lot of research that people are working more, due to technology, we're constantly working, and I think that's probably affecting some of those volunteer hours. But I was also wondering, with your program, how much of your program has volunteer opportunities during their work time versus is this add-on time after work?
It's both. So a lot of what we do is during working hours. I'd probably say it's about half. Half of what we do is during working hours. And we at UnitedHealthcare, it's up to the manager to decide, if you can take PTO, but then most of the time people will get paid to volunteer during the workday. So, but you're right, that is a problem, and we see even times of the year, depending on what industry you're in or what business you're in, that people are just like, I can't, I'm too busy, So we really try to be mindful of that. Our playground projects, that's a full day, 6 hours of building a playground, not to mention drive time and whatnot. So when we have those, we're asking a lot of, that can be a big ask to get away from their desks. So we're mindful of that. And we're also mindful of trying to give them opportunities that don't take as long or are easy to do on the side of their desk. Just really providing, I think, the opportunities the best you can, depending on who it is good. Like, we have some people that just want to do skills-based, and they can just sit at their desk over lunch and just help a nonprofit that they're working with, write a quick social media, content calendar, if you will. So I think it's really tailoring and providing options. But you're right, I think we're working a lot. Yes, Stephen.
I've been involved in that corporate model with Target. I understood it. I was the old guy involved in that program, but it definitely got the young people involved. You could do it at work. You had all the other benefits that come along with volunteering, but it was during the work time a lot.
Yep.
So how do you translate that to the community with younger people? Is that what you have to? We can't pay them. We can't provide them. Do we provide them treats? What do we?
Right. So you're asking, how do you incentivize the younger?
Into the younger.
Right.
Because corporately, not everybody works for big companies.
Right. No, that's.
It seems like that's a big opportunity out there.
Right. I've seen some nonprofits really kind of look at it in a couple different ways. They'll kind of make it seem like it's more of there'll be a little bit of a network component tied into the volunteer activity. I've seen that where it's like, well, come volunteer, but then also come meet all these different nonprofits, and they'll have giveaways and little tchotchkes that people will take. But gosh, I think a lot of it too is if you have, I don't know if you have a budget, but I've seen it work to just really target that demographic on social media. You can do what's called like geo-framing now, or it's kind of like based on your location. You could just advertise to like this demographic in this city. So you could be hitting those young people up on social media and saying, hey, we need your support, a quick 20-second video of why about your organization. That's what's going to get those young people in, because they're on those devices.
You may have mentioned this, but what percentage is skill-based volunteering versus group volunteering?
So our Do Good Live Well volunteer program is actually not skills-based at all. We're all about, not saying we won't be, but we're not right now. We do have a skills-based volunteer program at UnitedHealthcare, and it's just kicking off as we speak, more of a formalized one. We have lots of teams that do their own skill-based. Our legal team is always doing skills-based projects, our accounting team. So we do a lot of it, but we're definitely for the first time reaching out to nonprofits to say, let's put a more formal program together and maybe even offer these like sabbaticals, if you will, for our employees, like 1 month away from work, helping a nonprofit really solve an issue or figure out a problem. So I think that's something that companies will be doing more and more of, is kind of offering this more skills-based, longer-term, strategic take on it. Yes?
Take a little bit different tack than the woman here that mentioned about, she was surprised about only a third of the population who volunteered. I'm not surprised, quite frankly, because the time, you say your study shows that it's about the time.
Yep.
And that lack thereof. And, so I see that all the time in like civic organizations, whether it be Positively Fridley, as a volunteer organization, you see less and less people that are involved in nonprofits or civic organizations like Lions, JC, Rotaries. They're losing membership.
Yeah.
And so, if the study shows that it's the time factor, then what's the next step? Or does the study go further and say, why is there less time? I mean, we're all busy in our lives, of course. Yet, you know, the old adage about you find the busiest person, and that's the person you go to because they always seem to find time.
Yes.
So, I don't know if that's just kind of a cop-out for a lot of people, but I understand that jobs and stresses nowadays, but with all this wonderful, great technology, we're supposed to have more time, right?
Right.
I see it as more responsibilities and duties a lot of times, too.
Right. Well,
Email,
it's
texting,
yeah.
and all that other.
Right. It's like the whole house thing, you know.
In common, but the problem is that I see, okay, so we have identified the issue as being time and the shortness of it or lack of it. Is there any counteract to that restriction of time?
Not yet. We're trying. I mean, we're trying. You know, the one thing we do say though is that the one thing that we're saying, at least to our employees, is if you can do anything, especially with a lot of these, you know, we have had a couple bad years of, you know, hurricanes and fires and different crises across the country, and we say, well, if you can do anything, you know, if you can't volunteer, you know, can you give your, well, money. We don't straight ask our employee, hey, you need to give money, obviously, but I think a lot of people will now, just, you know what, I don't have time, just here's a check, just leave me alone, and, I mean, that's a little, I don't mean that, but, I don't know, and that's something that is kind of the age-old question. I don't know why or how we can, get it back up again, but.
I would think, per what Susan said, it's companies being more willing to give staff time if you're working time off during working hours, because there's no extra time after you leave for
Yes.
family and other things. But that's a challenge for companies with productivity,
Yes.
goals, and
Right.
where do you draw the line, and
Right, and that's why I think we're really trying to look at it more strategically with the skills-based and having that, you know, because obviously those skills they're using at work, and then they're using those to help a nonprofit, and it's showing that it's really effective. And our business leaders like it better, right, than just like, oh, you went and dug dirt for 6 hours.
how incentivized are the millennial group of your employees by having a charity that they want to give back to? Do most of them have a charity that they're well aligned with, and that's a real hook for them to want to do it, or?
So for us at UnitedHealthcare, we have a great giving program where it used to be that it had to be specific charities that you gave to, and then we give a match. Now you can give 365 days a year to any nonprofit, and UnitedHealthcare, or well, it's UnitedHealth Group actually, but will give a dollar for dollar match, except for political and religious organizations. But that's been huge for us to be able to do that, because for a while it was just for like 1 or 2 weeks out of the year. It was like the giving campaign, and you had to do it in that time. But it's great because now I give to the, you know, Heart Association, and then I could submit my receipt, or it comes right out of my paycheck. So companies are making giving money a lot easier. But you're right. I think it's about being flexible and giving that time. You know, more and more companies are doing volunteer time off, like they would PTO. But for us, it's going to be this sabbatical program. Oh, I'm sorry.
Well, I'll make a comment on, and then a question. I think one of the things is people with this time is, I think our priorities are definitely off whack and what's important in life.
Right.
And you put more time into things that aren't bringing fulfillment in your life and giving back to what's important, sharing with people. program then mainly trying to get for corporations and businesses to tie in with what you're doing? Or is there avenue to go into this website to like, for other people to be able to find connections and how they can help out in the community?
Yeah, so what we're about with our Do Good Live Well is just trying to instill that drive to want to volunteer, and then through the volunteer match system, connecting you to a nonprofit. That's what the volunteer program is about, and then, but obviously we have multiple kind of side programs that we're doing, but that's the biggest one. Yep.
How does UnitedHealthcare budget for these types of new approaches to volunteering, or is there a reallocation of resources that have always been a part of the organization's bottom line?
You know, it's always been a part, so UnitedHealthcare is, you know, we have health plans in all the states, so we're really like localized, if you will, and that's how our, so how our SR dollars are is like each kind of, you know, market has a budget around social responsibility. And I like our company because we let, you know, what nonprofits and what issues are important in Minnesota might be totally different than what's important in Texas. So they have their own budget to really kind of go local with who they're supporting and what they're doing. And then this Do Good Live Well budget is kind of the overarching separate budget that then gets kind of spread across the whole country. And again, that particular program, you know, we obviously can only go to markets where we have employees, right? Because part of our program is to get our employees out into the communities. Thankfully, we have employees in pretty much all big cities. So we just kind of look at, every year it's different. We look at the needs, we look at the issues, and what our employees are telling us, you know, they want, what our leaders are telling us, and we kind of just, every year, just kind of get our list of priority markets, if you will, and then that's how we pick our 45 projects that we do every year.
So I'm curious as to whether or not the outcomes that you're identifying, like mental health, self-esteem, all that, if they're the same for the doing activity versus giving money, and if there's any connection with seeing like a finished project, like if those numbers change, like if you see the playground being actually built in that day.
Yes. You know, that is a good, I've never had that question before. That's good. We should add that, because no, we don't look at that. We don't look at giving money. This is just straight volunteering. But I like what you mean about if you were a part of the whole thing, because last year we started these 2-day volunteer projects. So the first day we had a big group of people that were all just, you know, working hard to build all these, you know, new fitness spaces for high schoolers. And then the second day was when the high schoolers would come and we'd do this, you know, big unveil, and the door, you know, all dramatic, the doors would open and the kids would all run in and they'd just be crying and hugging, and it's just like, oh. And the volunteers that were there that day, so we do a volunteer survey, by the way. So our surveys for those people were higher than the day one people, and we would have the day one people say, oh, I really wish I could have been there to see the faces, and like it isn't as impactful as our playground builds, where it's the same group of people that start in the morning and then end and get to see the kids come. Those are our most impactful projects and are most like loved by employees, because studies, not our study, but studies do show that people will work harder and fundraise more if it's grueling or challenging. That's why, you know, a lot of, right, exactly, people do these, you know, obviously love why 5Ks and, you know, charity races and the polar plunge is so effective, is because there is this psychological connection that makes people feel that much better about themselves. I mean, I've jumped in that lake 3 times, people, and I don't recommend it. Yes?
Is there much of a volunteer component in the schools? There was a push at one time to have volunteering being part of the curriculum. I haven't heard of it much.
You know, that's a good question, because I've noticed that too when we work with schools, or even my own school in Apple Valley. I'm like, when you go to their website, it's like, there's no like give button or donate to our school, and I'm always like, how do I support my school? It's really, I think, district by district. It's just different. And I can't, I'm not an expert in that realm, so I don't feel fully confident in answering that question.
I think
But-
some of the Lions clubs work with the Panthers group. I don't know, Scott, do we do that in Fridley? I know Spring Lake Park does. Panthers, the Lions group works with the Panthers, which are
Well, Panthers is
student.
a Spring Lake Park group.
Yeah, is that where, oh, that's their team, yeah.
Yeah.
I'm talking about like high school kids, so that they can have a sense of what volunteering does, so it will. continue.
Oh, yes. So I do have a good story about that. So, we did a project in the Bronx last year, and the students were so moved by it that they actually started their own volunteer group, which was, they'd never had that before. And so we've actually had a couple calls with them, and we're kind of mentoring them on how to run your volunteer group. And so, but I don't think schools necessarily offer as much as they could around, here's how to set up your group, or just that support and the resources around having a student-led volunteer council. That's a really good question.
Hey, Patty, to answer your question about Lions in particular and working with youth or whatever, in Spring Lake Park, it's Panthers. So Lions International does have a subset, and it's called Leos.
Oh,
And
that's right,
to get
Leos, yeah.
students or kids, students age to get involved in volunteering. They're not real active here, I don't think, locally, but there is a Leos in the world, quite
Right.
frankly, that it's to get them involved at an earlier age.
Yes.
I'm gonna
Oh, sorry.
have this be the last question, because
Okay.
we need to move on to our
Yes,
panelists.
yes.
So I'm gonna go back to the corporate world, because I'm familiar with that.
Okay.
And all of this comes out of the giving bucket. For UnitedHealth or large corporations, you have a giving bucket, and part of this is volunteering, and part of it is, we're gonna give X number of dollars to Red Cross, or that's United Way, and those sorts of things.
Mm-hmm.
So now, let me look at United Way in Eden Prairie. From a volunteering or giving dollars or whatever, what does United Way or UnitedHealthcare do locally in, I believe you're based in Eden Prairie, isn't it?
Or in Minnetonka.
That is Minnetonka.
Yep.
Opus, right?
Yep. It's like right on the Hopkins, Minnetonka,
Yeah.
board.
So what could someone expect in Minnetonka to go to UnitedHealth and say, we want to do something with you locally?
Well, that's a good question. It just depends. We support lots of, I'm always gonna be the first to say it's never enough. Like, I wish we could do it's one of those hard things where there's so much need, there's so many nonprofits. But we get, requests.
Is there a
Daily.
deadline for requests before the next year for the 45 organizations you pick, or?
No, and so this specific program is nationwide. We obviously have we have a foundation that has different RFPs. We have our Minnesota health plans that have their own bucket. So we have lots of buckets, and so requests kind of will come in through all of them, but they all get taken seriously and they all get considered, and it just depends really on, what's the right fit, and that's.
So how do I'm from Minnetonka, I have this great idea.
You're talking to the right person.
How do I navigate a large corporation like that to get to the person who, there's a lot of requests just don't get responded to or pushed aside because they didn't go to the right person?
See, that's a good question, because each company kind of has a different, like for us, we have, we call it social responsibility. Another company might call it the, social impact team.
Sure.
So I guess when you're calling or reaching out to those organizations, you'd want to just be specific, like I want to talk to, your social responsibility or your
Would it be
social
helpful if
impact
after
team.
this presentation, we provide some tools and some links
Yeah,
for UnitedHealthcare, and we'll send it out to everybody?
sure.
We'll
Yep.
do that.
But that's a good question, and you're right. I mean, it's hard. It's hard to navigate that.
To get a large company
Yes.
involved right in their backyard.
Yes,
That's gotta be a big challenge.
yeah.
We'll work with you,
Yeah.
Jamie, to get
Yes.
some information to everybody.
Thank you so much. It has been a pleasure to be here, and
Thank you, Jamie.
thank you.
I want to just take a minute to thank our sponsors. UnitedHealthcare is one of them, Lee Carlson Center, and then obviously the city of Fridley too. Thanks for your sponsorship and your sharing the study results with us. Obviously, there's lots of people who are interested in why people volunteer and what's the benefit, so that's great. We are going to switch gears now and have three folks from the community have come today to talk as part of our panel. One of the missions of Compassion Action Network is to connect people locally to how they can have an impact in their community. And we're going to have three presenters. I'm going to introduce all of them right now, and then we'll just have them come up in the order that I introduce them. Our first presenter is Tricia Lehti from Anoka County RSVP, which is the Retired and Senior Volunteer Program. And that connects people with meaningful volunteer opportunities locally. People 55 and older get connected with volunteer opportunities locally. So she kind of has a broad scope, and she's going to talk a little bit about that with us. And then we have Ryan George here from the Fridley. He's a Fridley Police Deputy Director, and he's going to be speaking about the Fridley Police Department's Cops and Clergy program, which is a partnership between local police and faith-based organizations. And their goal is to provide assistance to people who need help or who are in crisis while maintaining safe and secure places of worship in our community. And then we have Roland Peterson, who will be speaking about the monthly food distribution that happens right here at Grace E. Free in Fridley. Each month, they have approximately 100 volunteers who distribute food to families in need in our surrounding community. And in 2008, they distributed 367,000 pounds of food, which is an incredible amount. If you've never seen their operation in action, it is quite impressive. All right, we'll have Tricia come up and start.
All right. Thank you all for letting us come and speak about our opportunities and braving this weather. We do appreciate that. We know it might have been a little difficult for some folks to make it here today. I'm Tricia Lehti. I will be talking about the Anoka County Retired and Senior Volunteer Program. We are a local program, and as Gail mentioned, we match local volunteers who are 55 or wiser with opportunities in Anoka County. So,
It's a good way to say it.
yes, we capture all of that experience, and the goal about that is really, it is part of a federal initiative to engage retirees in their community. And this happens throughout the United States. So RSVP you will find in multiple communities in Minnesota. You'll find them in multiple communities in other states as well. It was part of the Serve Kennedy Act. Anoka County RSVP has been in existence since 1973, since part of the inception of that program. Today, Anoka County RSVP has 450 active volunteers. And at any given time, right now, we have about 580 volunteers enrolled. But because of snowbirds and people that have cabins, at any given time, we probably have about 370 people who are serving at different points in the year. Volunteers may serve at one of our partnerships called stations. So we have about 50 agencies in Anoka County that are included in RSVP as a station. Volunteers, as you know, are critical to meeting needs in the community. These are a partial list of some of our sites where volunteers could be at, but again, we have 50 plus agencies, and that is ever evolving. So as new nonprofits are coming into Anoka County, we're constantly scanning the community and what the needs of our community is and engaging in conversation about creating partnerships. Who benefits from service provided by RSVP? In 2018, we had 226 people who received information from health insurance volunteers. They are serving with MAAA. When people are getting ready to enroll in the different healthcare option programs as they're retiring and need prescription drug coverage, Those volunteers are walking people through the myriad of options available to them and what they're using for resources and what their best costs are going to be. So that is done by volunteers, and that's kind of people get a lot of training in order to do that, and they do a phenomenal job. We had 13,400 plus individuals who received increased access to food from food shelves, Meals on Wheels programs, Man Markets, and a few others in there, some meal delivery programs. We also had about 3,400 plus seniors who received services which allowed them to stay independently living in their homes. Many of those could be meal delivery services for folks that can't get out. Some of those can be services as transportation, rides to medical appointments. So volunteers can be doing a lot of activities in that area. And then we have a tax assistance program where volunteers are providing income and property and mobile home rental rebate assistance. And 4,700 people received that assistance last year. That resulted in $2.6 million back into Anoka County. And many of those individuals there are a lot of individuals who come who likely wouldn't fill out those forms because they're too intimidated. So they wouldn't get those returns. And one story sticks with me. One woman, a volunteer, was able to do her taxes previously last year and the year prior. And the first return that she was going to get was going to be to buy another refrigerator. She had been putting her food in a cooler outside and said, with tears in her eyes, I can buy a refrigerator now. With her other return that came back, she said, now I'm going to buy a stove. So this person had been living in a mobile home, storing their food in a cooler, and we have people in the community that's happening to in our own backyards. So that's what the impact of volunteers do in the community. As you mentioned, there's lots of benefits to volunteering. There's lots of studies that are now starting to come out. A study by the Corporation for National and Community Service reveals that volunteers are reaping health benefits when they're helping others. Some of the effects are greater longevity, higher functional abilities, lower rates of depression, and reduced incidence of heart disease. The other thing that's not talked about as often, but in our program specifically, people who are 55 or wiser, after we are retiring from a career, in the United States, we usually associate our purpose with our career in life. So when we retire, we give up kind of a piece of our identity. So a lot of people find after they've retired for a couple of years and they've traveled, they've downsized their house or cleaned things out, they need something else to do. They need more of that purpose, to be connected to the community and not feel isolated as well. So volunteering helps people kind of feel involved in their community and get those connections back. The benefits of joining RSVP, as we've went over, are health rewards. People can try many opportunities. So the way we do things with RSVP, volunteers would send us an enrollment form. They fill out their interest checklist, and based on what you're interested in is what we would send you and start getting you connected to those opportunities. We're interested in finding people for a right fit. That means matching people to opportunities that they find meaningful, something that they're going to get more out of the experience than what they're giving. And so that we do that by the interest checklist, and we also do that by a phone orientation. It also allows you to explore something. If you had been working in a field and you didn't want to do anything related to that field, that happens. Some teachers would say, you know, I've taught youth and I really want to work with adults, or I want to do something where I can just come in and not use my brain in that way. It allows you to try some opportunities and get a feel for whether or not that's a good fit for you or not. We do quarterly newsletters, so our volunteers are getting some information on upcoming opportunities. So if there's a episodic event on Saturdays, evenings, or just something sounds appealing, volunteers have the opportunity to sign on and say yes to that in addition to what they're doing. So volunteers, you may find them at multiple organizations in RSVP, or some volunteers may choose to simply stay at one agency. And that's their choice, and we appreciate all volunteers. One that's on the very end of the spectrum, small percentage, we have a few volunteers who really want to reduce that isolation they're feeling and want to increase mental health. So a few volunteers will be out at sites, 6 different agencies, 6 different days a week, and then Sunday's their rest day. And they love it, they thrive on it. Not all volunteers are gonna find that same schedule rewarding. So it can be monthly or weekly, it just depends upon the organization and the vulnerability of clients that are served, would depend upon what someone might choose to do with that organization. Volunteers also get invitations to workshops and training events that we hold. Last fall, we had a training on senior scams and schemes and things that are happening local in the community. We partnered with the Blaine Police Department, and they gave a presentation on what they're seeing in the community, and also ways to prevent identity theft. So that's RSVP in a nutshell. If you want more information on that, I'm happy to talk with you. I have a booth downstairs. There's enrollment applications, but I'll let the other speakers present, and I will be around for questions. Thank you.
Did you want to share the stage with me? Kind of what we're doing goes hand in hand, because my stuff leads into what he's talking about. So, like I said, I'm Ryan George. I'm the Deputy Director here of the Fridley Police Department. And a few years ago, Mike Monsrud, he was a captain here before basically my predecessor, and he retired a couple of years ago. He started a program that he called Cops and Clergy. We recognized a need in our community to partner with our churches, our places of worship, just to protect them and the people who are going there, just because nowadays there's a lot of threats from within and from outside. But also, we wanted to partner with those faith-based organizations because we tend to run into the same people. Someone might go to a church because they need help, they need food, they're in crisis. Those are the same people that we're dealing with, and we wanted to be able to put some people that we run into in touch with someone who can maybe offer that spiritual support if they've just experienced a suicide or traumatic death or something in their house. We can call, now we have a chaplain program that came out of that. We can put someone in touch with someone who can offer that support. So it's a great relationship that we've had with some of our faith-based organizations, just because we are dealing with the same people. And then Courtney here, our crime prevention specialist, has gone out and done some kind of safety studies and surveys at some of the buildings to make sure that they're not opening themselves up to be burglarized or maybe an active shooter event or something there. So with that partnership, we've really developed some great partnerships with a few of the churches here in our city. Others are a little more difficult to reach. So if you are a member of a church or faith-based organization in this area, ask your pastor or whoever, are you a part of Cops and Clergy with the Fridley Police Department? Because we want to get people here, and we find sometimes it's hard to get people out of their silos, like people just like their safe space, and they don't like to commingle with everybody else. So we try to get that to happen. But one of the churches that we have really had a good relationship with is Grace Evangelical Free Church. Gerald Stigall is one of our chaplains who came out of this Cops and Clergy program. And he was telling me about this food distribution event that's run by volunteers from the church and in the community. And I said, Gerald, I need you to come talk about this. Unfortunately, he's in Colorado this week. I guess he didn't get away from the snow, but he said, you got to bring Pete in because he kind of runs this. And Pete, I'll let you kind of explain how you do this.
All right. The pastor certainly knew when to go away here, but he seems to think he's got grandkids in Colorado that he just has to go see. Well, I think this has been a very good connection, and just aside, our church does have a security team for every service that we carry on, there's a group of well-trained folks now that do, and they function well with the police, but you never know who's gonna come through your door. And I think we've tried to be alert to that. But the food distribution issue, I suppose, began in 2007. And I think we asked the question, hey, if our church ever disappeared, would anybody care? Anybody in the community even know we're gone? And we said, maybe we better wake up to something. I think there's needs in this community that we don't know, we aren't doing anything about. So we began in July of 2007 with a food distribution in which we worked together with Second Harvest. I think that, and since then it's been, we did it for 4 months. We did it the fourth Friday of the month. Well, you know, the fourth Friday of some months isn't very good. You run into conflicts. So we, with them together, just said, why don't we go the second Friday of every month? Obviously, that's going to happen tomorrow. Isn't that going to be nice? But anyhow, the second Friday of every month, and we've done it now, I think we're about 11 years and 9 months that we're working on this. And I don't know what you know about us, but this is a project, I think I have a couple facts that might just be helpful. Roughly, we give away about 30, well, if I could move the pages here, when you fold them together, I guess they don't come apart. Each month, Second Harvest, we get a straight truckload and a semi-truckload of food. And that amounts to, roughly speaking, about, well, during last year, we gave away 365,335 pounds of food. It's about 30+ thousand pounds every month. Sometimes a little bit more, sometimes a little less. And if we can round up something else besides what Second Harvest brings us, but we take whatever they send us. And we are not considered a food shelf. We are considered a food outlet. As a matter of fact, I think the information that comes to us is that they consider us an Anoka County mobile food outlet. I don't know where the mobile part comes. I suppose it's because we run around or whatever. I don't know. Anyhow, this takes about 100, at least 100 people every month to pull this off. We have a day crew that starts about, we'll start about 10 o'clock tomorrow morning, and we have to set the place up. We use our gym, and we set the food. It comes then in all kinds of, well, sometimes, once in a while, we think Second Harvest said, we've had this stuff around a long time, send it out there. So we get a mixture. You can get a pallet, but on that pallet, you'll get crackers and cookies, and then way down in the middle, there'll be something else. So we have to take that all apart and sort of sort it out as to how we can make this sensible. And then, of course, we will get pallets of potatoes and produce of many different kinds. It all has to be sort of sorted, or when they come, then we open, they start to register people about 2 in the afternoon so that they don't have to stand in line. They can just come in, and they get a time then when they can appear. We open the doors then at 6 o'clock, and we run it from 6 till about 8 or thereabouts. Generally, we're getting about 380, I think, what we call units last time. And a unit can be a family of whatever. Sometimes the kids are along, sometimes they're not. If you watch who goes through, you'd say, ooh, these folks have needs. So many times they'll cry because they haven't had anything. I think our pastor can give you testimony. We have folks then that the setup crew then sets it all up. We go right down the center of our gym, and we have tables on each side so they can go down, and we serve off the middle end with, and it moves along pretty well. And then we have about 30 grocery carts that we've picked up, and then we have volunteers that take those, what they get to their cars and help them get out of the way. That's kind of how it works, but it's, how do we train everybody for doing this? Well, probably should do better. We do have a video, and we say you have to watch the video. sometimes that doesn't always happen because sometimes we have needs, but in the daytime, obviously when we're using food, well, Pete had about 10 cents worth of training. I was supposed to get a certificate from Second Harvest. I did the training, but I didn't get the certificate, but anyhow, I think I'm legal. Anyhow, we gotta make sure that we keep things cool or cold, and if it comes frozen, we have blankets to keep it covered during the course of the day. But then people have to wash their hands, they can't be sick. We have to kind of watch that, and then use some kind of rubber gloves, plastic gloves that we have at church, so they aren't touching the food straight on. And then in the evening, it's more just handing it out and trying to make folks feel welcome and comfortable as they go through. That's kind of how the process works. And it goes every month, the second Friday of every month, and that's kind of how we're making it happen.
What I thought was really neat when Pete was telling me about some of the details of this program is the reach that it has. Because it's not just people from maybe Fridley, Spring Lake Park. It's families from all over the place that are receiving these, these allotments of food, basically. These units are coming in from even greater Minnesota, which is pretty cool.
Yeah, they do that. I try to keep track of this every month. But first of all, as a church, we said, so what's our community? And that was a little bit, so we took about a 5-mile radius around our church. Now, we got people coming from farther than that, but if you take 5 miles around our church, well, we had that very 5-mile circle, and about 70+% of our people are within that 5-mile radius. So, well, we had a program that said, yeah, but we can't figure out how many people there are unless you make it square, because we can't figure out how you... So we made it square. So we said our community is 35W on the east, 252 on the west. You say, why 252 on the west? Because our pastor lives over there. And then about 99th on the north, and then 37th on the south. So that gives us Columbia Heights and Blaine. And anyhow, you should know that in that, what we call that community, by the way, there are 108 churches. And their attendance in those churches is about 32,000 people. 108,000, but there's about 110,000 people. So about 30% of the people attend church, whatever that's worth for you. But anyhow, where does this go? And you should know, I just took one data, but I guess this was in November. 63 of the units came from Fridley, 53 from Minneapolis, 39 from Coon Rapids, 29 from Columbia Heights, 24 from Blaine, 16 from Mounds View, 10 from Brooklyn Park, 8 from New Brighton, 6 from Spring Lake Park, and 4 from Brooklyn Center. That would be areas that would be within our community. That amounted to about 76% of the food went to that community. And then in the greater Minneapolis area, there were 64. About 19% went into greater Twin Cities cities, and about 15 or 5%, as you pointed out, go to outside of what we call greater Minnesota. Even once we've had Illinois in here, we've had North Dakota. Sometimes that's hard to figure out where they're coming from, but we also get every month we get a group from Mora that come, and so that's kind of an interesting piece. But that's who we reach with this ministry. I don't know.
We have any questions for any of the three panelists? Go ahead.
I'm guessing you have leftovers sometimes. What do you guys do with that?
Oh, leftovers. Well, you can come by, but no. Well, there's a farmer that says, I'll take anything you have. But at the same time, we also put together what we call blessing boxes. And we have a list of folks that we can put boxes together. Also, you should know, I spent about 40 years at the University of Minnesota, and I'm an advisor for a fraternity called Farmhouse Fraternity on the St. Paul campus. And we usually get, well, they promise they're going to have a dozen tomorrow. volunteers come. They come in the evening to push carts. But anyhow, we'll give them a little bit for their efforts. But usually if it doesn't go to those, then there's a farmer there that says, we have tried to do, if there's some extra to some of the mission groups. It's interesting, sometimes the president says, we'll take it, and then you bring it there and the cook says, I don't want it. So that's a little bit of a problem. I mean, usually we try to calculate how many we think. We're right now calculating that we're gonna have 400, and then they watch so that as the lines are coming through, they'll give a little bit more so that we don't wind up with a lot at the end. But that's kind of, most months, if you came there at 8 o'clock, there's not a lot left. And sometimes folks that come late don't get everything that was there. So we'll pile up, they'll get all kind, if we got cereal, they'll get all kinds of cereal. Versus some other things that we've run out of. So that's kind of how it works.
Any other questions? All right. Just want to remind you about your evaluation forms. If you can fill those out and just leave them on your chair, that would be great. Also, the resource tables will be open downstairs, so feel free to stop by and visit them. Thank you all for coming. Stay safe this afternoon.